Thank you. Commissioner, I do have a couple of questions. So first of all, thank you for being here today. We truly appreciate your testimony. As you know, we've been pushing hard over the years to actually expand access to mental health services through Kendra's Law, assisted outpatient treatment. And every week, unfortunately, I still read in the newspapers from across the state that we have acts of violence. People are falling through the cracks. People who haven't gotten services for whatever reason. Maybe they're off their meds. And I just want to point out to you that I would love to work with you in the future and the governor to see what we can do to stop a lot of those cases, because obviously they impact people's quality of life. And what we see right now is, you know, a rise in homelessness. And I'm glad there's supportive housing in the budget, but I think there's more that we can do. There's a rise in addiction, and we'll hear from the commissioner of OASS in a few minutes. But obviously people are self-medicating in many cases because of an underlying mental health issue. We have a rise in PTSD with our veterans coming home, and some of our veterans, World War II, Vietnam, they still suffer from those issues. So I believe very strongly we need more mental health services in the state. I listened intently to your answer to Assemblyman O'Donnell. He and I, as you know, have worked together, especially after that notorious case with Daniel St. Hubert, who stabbed in a NYCHA elevator. That tragic case, Michaela Capers, 7 years old, and PJ, a widow, 6 years old. Michaela survived, PJ did not. And so it sounds like you're making progress with the $20 million that the legislature put into the budget last year. And I appreciate your answer, and it sounds like we're in the right direction, but one of the questions we have in the Senate, because we haven't been able to get this information yet, how much of that $20 million has actually been utilized from a monetary standpoint? And this obviously can't be a one-shot. If these wraparound services, the different new steps that you're taking to make sure that people released from prison get the services that they need so they don't commit violent acts once they're out in the public. Obviously, that's a very serious issue. Where are we at in the funding? Do you need more funding this year to continue these services and actually expand these services?
These services are embedded in the budget, so they will be ongoing services, the $20 million. That's not one shot. Those $20 million for the seriously mentally ill, violent, that is in. But
excuse me, Commissioner, how much have you spent?
We've spent, I think we've spent close to 18 million of it. I mean, there's a few dollars that have not gone out yet, maybe a little bit less, because there were 400 beds that were going out. I think 200 of them are now operational, so that money hasn't yet been spent. The RFP is out for the beds in the community. So I think that there are some dollars, but we're up there. We're up there in the high level. I can get you the exact amount that we've spent on the SMI, and I'll let you know exactly how much. But it is ongoing dollars. Those dollars do not stop.
But sure. So, Commissioner, you just said you spent 18 of the 20
million?
million?
I think probably, but I'll get you the exact number. It's a high number because we've put up the inpatient units, we've put up the services in the prisons, and we've put up a whole bunch of outpatient ACT teams and stuff. So I think we're close to having spent a lot of the money. So you've spent 18 of the 20 million that was allocated in the 2016 budget. So what's going into 2017? It's all reallocated. It's all in the budget. The $20 million for these services were added to our budget on an ongoing basis.
Okay. Well, I'm sure our staff will have ongoing conversations about that, because
it has to.
Obviously, as I said, it sounds like you've made progress. So we want that progress to continue. Absolutely. We want that protection of people to continue, and we want people who have mental health concerns that are serious getting the services that they need. You mentioned earlier to me that you're making progress on telehealth. Could you give a very, very brief overview of what you're doing with telehealth in the department? Yeah, we have recently released the regulations that will enable the places to become certified to provide telehealth. We've had 30 applications across the state and more coming in, I think, from the districts. Some of this is telehealth from emergency rooms to clinics, from clinics to inpatient units to emergency rooms, connecting clinics across sites. It's really very exciting. And we have been setting them up all over the state. So the applications are in. We're expecting to actually approve them over the next month or so, and it'll be out there. I think it's tremendously exciting, and thank you for getting the commercial payment for
for telehealth. I think with the shortage that we have of providers, it's just a wonderful technology that we have just not utilized enough. And we have lots of applications, and with DishRip, lots of them are coming to us even more so, saying, can we do telehealth here, there? So we're sending out all the guidance. And we also got a small grant to help people with some of the technology for some smaller clinics that really couldn't afford, to make sure they were absolutely, safe in terms of transmission of information. And we've helped them with that with some grant dollars. So the big hospitals, they can afford it, but the smaller places need it. So we're really seeding it across the state.
Thank you, Commissioner. That's great to hear. Thank you.
Thank you very much.
Oh, I'm sorry. Senator Kruger. Can't forget about Senator Kruger.
To close.
I thought everybody would ask my questions, but we have 2 left. The research shows that 20 to 25% of the people in the shelter system for homeless are actually suffering from mental illness. Is there any mechanism where your agency evaluates how many people have actually been in your system and ended up in the New York City shelter system? Do you do any comparison tracking? Obviously, there's HIPAA issues, so you aren't necessarily giving out their names and information, but do you cross-check to see? Because I'm very concerned that in our emptying out of facilities and claiming we're offering community facilities, what we may in fact be doing is dumping people in the shelter system.
Yeah, we have not been, it's a very important point, and it's very good. We have not been routinely collecting that data. I think that we can try. We can try to figure out if there's a way with the shelter systems, which are run by, often by the city, to kind of track and understand, because you're absolutely right. I mean, we should not be, we look at, from Medicaid data, we know about rehospitalizations and ER visits, but we have not been able yet to track that, but we will definitely look into it, because I think it's a very important point that we don't want to be losing people through the shelter system. That's not our goal with all these community reinvestment dollars at all. So we will do that. We will look into it.
I appreciate that. And then also follow up. So you have funds for your own supportive housing units that come through your budget. Questions were asked. How do you have to be homeless to get into those supportive units as you do most other supportive units, at least in New York City?
It depends on where the funding is coming from. Some of them you're required to be homeless, some of them you're not. It varies on where the funding initially came from. If it's old New York 3 funding, homelessness was a requirement of a good part of New York 3. Other funding came from other sources. It takes years for the housing to come up. So sometimes it's not required to be homeless.
And so when you're not required to be homeless, it's your department who's determining, we have decided there is this slot and this person is going to go into it?
Yes. Mm-hmm. Yes.
Thank you.
Thank you very much.
Thank you, Commissioner.
Thank you.
Great to have you here.
Thank you.
Next, Kerry Delaney, Acting Commissioner, New York State Office for People with Developmental Disabilities.
Thanks, sir.
I'd like to point out that we've been joined by Senator Velmanette Montgomery.
Thank you. 60 miles out. Okay. Yes, 1, 2, 5, 3. All right, thank you.
Good morning, Senator Young, Assemblyman Farrell, Senator Ort, Assemblywoman Gunther, and other distinguished members of the Senate and Assembly. I'm Kerry Delaney, Acting Commissioner for the New York State Office for People with Developmental Disabilities. I'd like to thank you for the opportunity to testify regarding Governor Cuomo's 2016-17 executive budget proposal for OPWDD. The Governor's executive budget supports the ongoing transformation of OPWDD's service delivery system and the implementation of recommendations of the Transformation Panel, a group of individuals, parents, providers, legislators, and other experts in our field who were called together to provide their insight and advice on implementing sustainable system-wide change and the priorities that have emerged from this year of unprecedented public outreach and engagement. Working in close partnership with our network of provider agencies, OPWDD ensures that quality services are delivered to over 130,000 people with developmental disabilities in New York State, as we continue to work to design the system of the future. This budget provides more than $4.2 billion to continue providing services in integrated community-based settings and supports OPWDD's vigilant oversight of state and not-for-profit agency providers. This budget represents an increase of $175 million, or 4.3% over last year's budget. The Governor proposes making significant investments in new service opportunities by supporting up to 6,000 new or expanded services, including certified and non-certified residential supports, day programs, employment, case management, and respite. These new opportunities will support people currently living at home whose needs have changed. The additional resources are separate from a reinvestment of $24 million to support the transition of individuals from developmental centers and intermediate care facilities to more integrated community-based supports. The Governor's budget also provides $15 million to expand OPWDD's successful START crisis intervention program, invests $15 million in affordable housing development opportunities, and supports a cost of living adjustment and Medicaid trend to increase reimbursement levels of not-for-profit providers. This new funding will allow OPWDD to continue to expand services to meet the growing demand. We're currently providing residential supports for nearly 38,000 of the 130,000 people with developmental disabilities that receive our services. In the last 18 months alone, OPWDD has provided certified community-based residential supports to 2,600 new people who required a more supportive living environment, including 1,525 who moved from home to an OPWDD certified residence for the first time. In addition, OPWDD offered 3,800 people the opportunity to receive employment supports, helped 2,300 new people to self-direct their services, expanded respite services to 5,500 people who were new to that service, and enrolled 6,400 new people in day services. These service expansions would not be possible without strong legislative support, and we look forward to continuing that partnership. As you know, last year's budget agreement provided OPWDD with the resources and responsibility to undertake a year of significant public outreach, data collection, and analysis in order to better plan for a sustainable future. On behalf of all of OPWDD's stakeholders, I'd like to thank you for supporting this outreach, which included statewide public forums to help inform the recommendations of the Transformation Panel, and integrated employment forums, which gave stakeholders the opportunity to provide input into integrated employment opportunities. In addition, with your support, OPWDD worked this year to contact every person who had indicated an interest in receiving residential services through the Residential Request List initiative to determine if they had immediate needs that must be met and help OPWDD plan its future for residential services. More than 24,000 outbound calls were made, and more than 12,000 letters were sent out as a part of this very successful effort. Information, feedback, and data gathered in the various public forums and from stakeholders is currently being used to develop written reports to the legislature, which will be submitted on February 15th. These reports will provide the results of this outreach and analysis in areas such as self-direction efforts, workshop transformation and residential services, as well as lay out a plan to implement the Transformation Panel recommendations and the path forward for our service delivery system. Much of OPWDD's transformative efforts in 2016 will be based on the feedback that we received from our valued stakeholders, most importantly, the people who receive our services and supports, their family members, as well as the work of the Transformation Panel. We're in the process of studying all of the public comments on the panel's draft recommendations, and will soon be issuing a final report incorporating that feedback. OPWDD looks forward to working with our partners in the legislature and all of our stakeholders in the continuing effort to achieve real and lasting transformation in our system. I welcome your questions.
Thank you very much. Assemblywoman Gunther.
Thank you, Commissioner. When you say there are 6,000 new opportunities for people with DD, are those actual new opportunities, or are they slots that you are filling, slots that are already there that someone's moving out, or are there actually new opportunities?
It depends on the circumstance. When a person presents to us with a given need, we develop a person-centered plan for that person. Of course, we look in the first instance at whether our existing opportunities can meet that need. If they can, we would offer that opportunity, and if they cannot, we would develop that opportunity for the person.
How many people do you feel at this point are on the waiting list for residential?
At any given time, we have between 11 and 12,000 people who have indicated an interest in a residential service in our system. As of today, the number is right around 11,000. These are people that at some point in their contact with OPWDD indicated that they would have an interest in receiving that residential placement. So it really is anywhere between 11 and 12,000.
So I have, in one facility that I've been contacted by, they have 30 pediatric beds that are filled, and these are folks that cannot exist on their own. They can't have independent living. They are in pediatric beds awaiting to be placed residentially. And they have been that way for over a year. So I'm trying to understand the fact that, you know, we're saying we're rising to the occasion, we're creating residential spots, and then as I go across the state of New York, I'm listening to aging parents from Buffalo down to Long Island. There's no difference. And there have been many, many parents that are frightened because they don't know what will happen to their child or their adult child at this point. So I don't really know, when we talk about 6,000 slots, are we refilling slots if somebody passes away, or maybe some go to long-term care, I don't know. But are there really 6,000 new slots?
The question of how we can address the need for residential service is one that we take very seriously. And last year, having heard the same concerns that you're hearing about people who are waiting to access a residential placement, we did begin that outreach effort to really try to help us better plan for our residential service system. As I said, we are working to analyze those results, but I can tell you that there were over 500 people as a result of that work that were immediately referred to our front door, and plans are now being put in place for those people.
You know, I've heard a lot about the front door, and not always the most positive description of how the front door works. And I think that we really need to improve the front door. Now I want to talk about, and I should have talked about it with the OMH too, about the 0.2% COLA. You know, for years and years and years, our folks that have been taking care of our vulnerable population, both the DD population and also the OMH population, have really not received a raise. A couple of years in a row, they got a 2%. And I mean, honestly, if you think about the cost of living, it's almost impossible. And I will always say this is mostly a woman's career, and these women are working 2 jobs. You know, to take care of our most vulnerable population, they need an increase in salary. And with what's happening with minimum wage, and it's not that I don't support it, but how are we going to keep people in this occupation taking care of this fragile population without really looking at the amount of money they make on a weekly basis. And it's not uncommon that they do one shift, sometimes a 12-hour shift, and they're extended because there's no one to fill their place and take care of these vulnerable individuals.
We definitely have been working with the Transformation Panel on how we can, first of all, address issues that are longstanding in our system with developing career ladders and professional pathways for direct support professionals, because we do see a lot of people come to the profession, but retention is certainly an issue. As you flagged, we have with legislative support provided a 2% COLA twice in the last year, and we are proposing to pass through the statutory COLA this year as well. But certainly more needs to be done and considered as we think about ensuring that we have a robust direct support workforce.
This is like 40 cents a week. To get that's not an increase. That's to me, and not anything to do with you. That's an insult. That's an absolute insult to say to somebody who's killing themselves, backbreaking work, that I'm going to give you an increase in pay and expect somebody for jump for joy, as my grandchildren would say. And I just think it's so very unfair. And statutorily, if we have to provide this 0.2% COLA, what happened the years before when those statutes were in place and nobody got any increases? So what's good for the goose is good for the gander, and so if we go back all those years with no increases, then we should be making up for lost time. And I know it's not you, but I think in this budget of $149 billion that we should be paying these folks an appropriate living wage, and we are not, and taking care of very, very vulnerable people. And, I just kind of want to bring that back and make sure that maybe we can address it out of the $149 billion. We give McDonald's, Burger King, and I'll say the names, all kinds of abatements. We do all kinds of things for these corporations that are making billions of dollars, and we need to take care of our own. And of course, and take care of this population. OPWD has been also conducting boot camps at DDSO in order to hire staff over the past year. How many staff have we hired?
As a result of the boot camps, which was an effort that we undertook around the state to try to onboard a significant number of staff in each of our districts, we have seen several hundred staff now hired, and we have a number of other staff that are in the clearance process from those boot camps that we expect to bring on board in the coming months. We've experienced some challenges as we've continued to move forward with this hiring effort, and are working with civil service on resolving those challenges.
I also just want to touch on the methodology for reimbursement. It's almost a one-size-fits-all. No matter where you are on the spectrum, it seems that everybody gets assessed. Sometimes the one person could be a much more difficult case that requires more care, but our methodology always has been one-size-fits-all.
Actually, in the last couple of years, we have been working with the Department of Health as the Medicaid rate-setting entity to transition from a budget-based methodology where providers would submit a proposed budget to us and their rates would be based on that budget to cost-based reimbursement based on their actual costs, and reimbursement that also reflects what's paid by other providers in that region. We began, as you know, with those changes to the reimbursement methodology a couple of years ago and have a multi-year phase-in schedule for accomplishing that. In addition, we provide specialized funding for people with higher needs who are leaving institutional settings and transitioning into the community.
I know I speak to many of the agencies that are providing these services, and they are really having a difficult time with survival because of reimbursement, because of mandates from the state of New York, and just in general, the cost of living is going up, but their reimbursements, their rates are not going up, yet the amount of work that they have to do at this point is only increasing. We're doing all kinds of new rules and regulations that they have to implement, that they have to teach their staff, and it's just there's no balance.
We have heard those concerns as well. It's certainly something that was flagged by Transformation Panel members as an area where we really need to focus on looking at how we can streamline some of the regulations and requirements and try to help providers move forward into the new rate methodology and new rate structures in a way that lessens some of the burden on them.
You know, when I think about the number and the increase in the number of children being diagnosed on the spectrum, and 1 out of 6 boys, I mean, it's truly a tsunami. And these are young people that are in the education system, and at 20 years old, they're going to have to find a place to go, a place to be, a safe place. And I just don't think, without really stepping up, investing money for whether it's living situation, job training, you name it, but we're not doing it. And we're rolling the ball down the hill, and it's happening now. These kids are graduating, and it's a very hard thing when a child goes to school till they're 20 years old, and there's all of a sudden that they have nowhere to go. They're sitting at home with parents that are aging. They become depressed, anxious, and it's not a quality of life that we're planning for all of these young people that are going to be out of the education system with no place to go. And I know that you're aware of it, but I think we as a community and as a state have to work a lot harder.
We have about a quarter of our population that we serve now with an autism diagnosis. And you're absolutely correct that there are many students coming up through the school system impacted by autism, and their needs, as you know, are varied, as autism is a spectrum condition. One of the things that we've really been focused on over the last couple of years is working much sooner with students in the education system so that we can much earlier plan for their transition services, because we recognize that it often takes time to find the right adult services for those students, and we've been trying to work much earlier with those school districts than when the child is turning 20 or 21 and aging out of their educational programs.
If you look at the education system and you look how many speech pathologists and early intervention, and you look at the backlog on that alone, to have those evaluations, whether it's a guidance counselor or a social worker, I mean, we've decreased that staff to the point where it's bare bones. There's like one guidance counselor to 500 kids. So I think that our intention is good, but we really have to increase the number of staffing in order to do the appropriate valuation and prepare for the quality of life for all these young people.
Thank you.
Thank you.
Thank you, Senator.
Thank you, and great to see you, Acting Commissioner. Welcome. Our next speaker is Senator Robert Ort.
Good morning, Commissioner, or
Morning.
good afternoon. Most of all, Medicaid falls under the DOH Medicaid cap, as you know. OPWD is not under the DOH Medicaid cap. With all their Medicaid under the cap, which has grown at 3 to 4% per year for an overall growth of 23% over the last several years. Yet OPWD Medicaid has remained flat. Why has there been no comparable increase for OPWD Medicaid?
Actually, if you look at the amount of funding that's available for OPWDD services this year, we are seeing an increase on those service dollars of around $175 million. So we have seen some increases to help us accommodate the needs of individuals coming to our system.